truth over fear. And since we can't say anything in this sensitive ass country, well, then why don't we let them say it in their little Event 201 simulation? And I hope I didn't hurt anybody's feelings by saying that. You know, Event 201. Hope that doesn't hurt anybody.
We have called this meeting today because of major strategic problems around communication that are happening globally. And here's a media debate that just happened on air today.
Alarming news emerging from social media companies today about the CAPS pandemic. Twitter and Facebook are reporting they've identified and deleted a disturbing number of accounts dedicated to spreading disinformation about the outbreak. For more on this, we go to our correspondent, Catalina Parks.
Chen, these accounts were created by several state-sponsored groups intending to sow political discord, and some individuals are seemingly seeking to gain financial advantages. Violence against healthcare workers and minority populations has been increasing. A recent riot highlights the real danger in these posts. Countries are reacting in different ways as to how best to manage the overwhelming amounts of dis and misinformation circulating over the internet. In some cases, limited internet shutdowns are being implemented to quell panic.
Thank you, Catalina. For more on this, we are joined by experts on crisis communications and social media, Kevin McAleese and Sarah Lee.
To me, it is clear countries need to make strong efforts to manage both mis- and disinformation. We know social media companies are working around the clock to combat these disinformation campaigns. The task of identifying every bad actor is immense. And experts agree that new disinformation campaigns are being generated every day. This is a huge problem that's going to keep us from ending the pandemic and might even lead to the fall of governments, as we saw in the Arab Spring. If the solution means controlling and reducing access to information, I think it's the right choice.
I agree with Kevin. This is a big problem and doesn't even account for the massive amounts of misinformation being generated by legitimate users about the pandemic. But it's not just trolls who are spreading the fake news. It's often political leaders themselves. Who's to judge what's real or not? Would we trust every government to separate truth from lies?
I think this is more than just keeping the bad information out. It's also about making sure real public health information reaches the public. News is found from outlets other than social media. News organisations, public health groups and companies need to help people take the right actions to protect themselves by promoting accurate, real information about the outbreak.
Okay, for more on this, we're going to get a briefing from our communications expert, Dr. Sell.
Global health experts have highlighted that dis and misinformation are wreaking havoc on the CAPS response. Health workers are under attack in a number of locations due to rumors that they are purposely spreading the disease. And response efforts in many places have had to be suspended because of concerns around violence. Pharmaceutical companies are being accused of introducing the CAPS virus so they can make money on drugs and vaccines, and have seen public faith in their products plummet. Unrest due to false rumors and divisive messaging is rising and is exacerbating spread of the disease as levels of trust fall and people stop cooperating with response efforts. This is a massive problem, one that threatens governments and trusted institutions. Polls have shown that mis and disinformation are ubiquitous. At least 90% of the public has been exposed to these messages. At the same time, misinformation messages come from a variety of sources, even government officials. And often governments are contradicting one another. We know that social media is now the primary way that many people get their news. So interruptions to these platforms could curb the spread of misinformation, but could also limit access to information from legitimate sources. Health ministries around the world are attempting to combat mis and disinformation by amplifying public health messaging through social and traditional media. But they are being outpaced by false and misleading information. National governments are considering or have already implemented a range of interventions to combat misinformation. Some governments have taken control of national access to the internet. Others are censoring websites and social media content. and a small number have shut down internet access completely to prevent the spread of misinformation. Penalties have been put in place for spreading harmful falsehoods, including arrests. Other countries have taken a more moderate approach and have focused on promoting fact-checking efforts and working with traditional media outlets, yet these approaches are limited in scope. Social media companies report that they're doing all they can to limit the use of their platforms for nefarious or misleading purposes. But this is a technically difficult problem, and false, misleading, or half-true information is difficult to sort without limiting potentially true messages. The bottom line is that members of the public no longer know who to trust. Both the misinformation and the measures to control it have led to a crisis of confidence.
Thank you, Dr. Sell. So here's the policy crisis for this meeting of the board. How can governments, international businesses, international organizations ensure that reliable information is getting to the public and prevent highly damaging and false information to the extent that's possible about the pandemic from spreading and causing deepening crisis around the world? How much control of information should there be, and by whom? And how can false information be effectively challenged? And what if that false information is coming from companies or from governments? So, your views would welcome.
So I would start by pursuing where trust exists in the ecosystem. Jane, in a prior meeting, mentioned that there's considerable trust by employees of their employer, and that's been borne out by our own trust barometer in the last several years, where it's extraordinary the amount of trust given to the employer. And coupled with that, in times of crisis, as we're living, the role of the CEO and the trust given to the CEO for advocacy and for advancement of accurate information is considerable. I would marry the business leadership of the employer with business leadership organizations, such as the BRT and like enterprises around the globe. But I also think we're at a moment where the social media platforms have to step forward and recognize the moment to assert that they're a technology platform and not a broadcaster is over. They, in fact, have to be a participant in broadcasting accurate information and partnering with the scientific and health communities to counterweight, if not flood the zone, of accurate information, because to put the genie back in the bottle of the misinformation and disinformation is nigh impossible.
So flood good information. Okay, others, yeah, Jane?
Yeah, so can I agree with that? And my fact, it did come from the Edelman Trust Index, you'll be pleased to know, but also borne out by the work I've done as a CEO in my time. Can I also add that I think there are real technology opportunities here. I personally do not believe that trying to shut things down in terms of information is either practical or desirable. And we do have, I think, a couple of strategies that are available to us, one of which is the flood strategy, second of which is relying and informing and equipping trusted sources of information with the facts so they can then pass that on. But we also need to actually think about a technological answer to this. So there is work that's being done to actually create algorithms to sift through information on these kind of social media platforms. And I know that the Gates Foundation and others are funding organisations to work on things like this in order that people can actually have more confidence in the sources that they will use in any event. So I think both a detailed solution working with individuals, but then also thinking about technology is something we have to advance.
Asti.
So looping back into the trust barometer, last year in Davos it was released that trust in traditional media sources has grown, while trust in social media sources has gone down, specifically after the last elections in the United States. So I think one of the ways that we need to approach this is to make sure that we have the right representatives on traditional media networks in order to portray our side of the story and make sure that
portray our side of the story.
I agree with Jane that shutting down internet is only going to cause extra panic and extra anxiety. In fact, that staff tells me places where internet access has been shut down, there's unrest growing. So we're not only dealing with this specific situation, but really people not trusting their governments at this point. And so I think we really need to make sure, one,
in other words, we need the masses to trust us so that we can continue with our agenda and get rid or flush out the people that are talking the truth.
Trusting in employees, in your employers. There are lots of communications channel. For example, during the Ebola crisis at Texas Children's Hospital, we had daily briefings with the CDC to tell us what the situation was. And because of those daily briefings, we used, between the intranet, internal global communications, and town halls, we use those sources to be able to disseminate information and make sure that our employees knew exactly what was going on, coming straight from the source, whether it was from our CEO, our chief nursing officer, or others within the hospital.
Okay, Tim and Chris? Oh, sorry.
No, I think a complementary tactic too is to tap faith-based organizations and civil society and other institutions to recruit them also to basically, almost at a grassroots level, continue to basically have the integrity of the information.
So I just pick up on the daily briefings, or twice daily briefings. During H1N1, WHO filled the parking lot in Geneva with the global press and provided them daily updates on what was happening. And I think that's a manifestation of flood, meaning you have to lead and lead regularly. And I think in the terms of the content is what we know, and point to where communications have actually been pretty good. I think we projected the exponential increase in this quite well, and therefore there's legitimacy to what's being communicated. And so be clear about what's being communicated that we know and that is right, but also be very clear about communicating what is absolutely wrong, and being clear about that. And then also being clear about uncertainty and that that's being managed. So I think in those three domains, very important not to deny, but to speak to them very clearly in the context of a daily briefing from, in this case, I can't imagine any other institution than WHO being the focal point.
Martin and Chris, and then I'll come down this line.
Thank you. I fully agree that this is pure crisis communication, and crisis communication today, also social media is part of it. And just to limit or even stop social media would create a huge damage. And we should use it, we should get it on our side, we should work together with them, and we should try to avoid this misinformation. And another topic is, I mean, our industry, there are indications meanwhile that we are getting this social conspiracy theory topic, that we are part of this conspiracy theory, that we are supporting this, that wealthy countries will spread out caps to poorer countries. And this is a clearly thing of social media that could be directed via clear crisis communication and confirmed and regular updated information. So I also agree with Matthew, companies' this responsibility that the CEO talks to the staff, that the CEO improves this information flow, and then we have a chance to get it channeled.
So in this case, are governments, do you think governments are at the point where they need to require social media companies to operate in a certain way? I hear you saying social media companies should not be impaired. Yep. But do they need to operate under different conditions? I think Matt alluded to that as well.
I would say there are specific conditions now, and we have to find a way to cooperate and to have to find solutions for this, but not to hamper them.
Chris?
So I just want to build on Ed's comment about the importance of civil society and faith-based communities. I think, in addition to employers, people trust their neighbors, trust their local community organizations. With 3 million cases in the Americas, you know that local communities around the countries have been responding, whether it's to manage daycare so people can stay in school or go to work. So while the social media can provide better quality information, I think actually local community organizations can help individuals understand how to filter out some of the noise and to act on the good information that's there. I think it's an important lesson that we've learned recently. We're learning as we speak in East Africa with the Ebola outbreak. If you don't have the community trust and engagement, you can't deliver even effective countermeasures, even when you have them. So I think the importance of local community, perhaps married to and as a filter for helping to discern the truth from the misinformation on the technology platforms, is going to be an important part of this response.
Steve, Brad, and then we'll go down the table here.
Just 2 points. First is that
we have to recognize that we are all susceptible to misinformation based on our prior beliefs and experience. And I think with the social media platforms, there's an opportunity to understand who it is that's susceptible in what form to misinformation. So I think there's an opportunity to collect data from that communication mechanism. The second thing is, with that ability, we can identify false information more quickly. We are actually receiving reports about people trying treatments that are purported to be effective but are actually harmful. And the quicker that's recognized and can be countered, the fewer people will fall susceptible to those things.
Okay, thanks, Brad.
Yeah, I don't want to be repetitive. I agree with almost everything that was said, but when we talk about our health, who do we typically trust? Our physician. And we're not talking about that right now. So, I mean, we need the physicians and the medical community really out there on the forefront talking about this. I remember I had access to local news in Atlanta when the patient was taken care of for Ebola that came back. And physicians were on there nightly talking about, you know, don't panic. It's okay. This isn't going to go spread. So I would add physicians.
Yeah, because you want us to trust the experts.
Rumors are actually spreading that the antivirals are causing CAPS, and so patients are not taking them anymore. And this is particularly an area where we have government mistrust.
About the public communication, my team has been monitoring the public response, and on various social media channels and cable networks, there's been some conspiracy theories that are around about the potential that pharmaceutical companies or the UN have released this for their own benefit. So as we move forward, obviously trust in pharmaceuticals and government is very important at this moment. And so as we move forward with developing the right scenarios, we have to make sure that the public communication is a major part of that because of these conspiracy theories.
While others were desperately striving to hold on to power, this spurred further crackdowns. Attempts to control media messaging, originally aimed only at health-related misinformation, became used increasingly to quash political dissent. Economists say the economic turmoil caused by such a pandemic will last for years, perhaps a decade. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer.
And I ask that you make your responses as brief and to the point as possible. And if I ask you a yes or no question, I'm just looking for a yes or no. So please respond appropriately. I want to start by asking all three of you. If your platform bears some responsibility for disseminating misinformation related to the deletion of the Truth Channel movement that led to the attack on the channel, just a yes or no answer. Mr. Zuckerberg.
Chairman, I think our responsibility is to build systems that can help.
Mr. Zuckerberg, I just want a yes or no answer. Okay, yes or no? Do you bear some responsibility of what happened?
Congressman, our responsibility is to make sure that we build effective systems.
Okay, the gentleman does not want to answer the question. Mr. Pachai, yes or no?
We always feel a deep sense of responsibility, but I think we worked hard. This election effort was one of our most substantive efforts.
Is that a yes or a no?
Congressman, it's a complex question.
Okay, we'll move on. Mr. Dorsey.
Yes, but you also have to take into consideration a broader ecosystem. It's not just about the technology platforms we use.
Smell.
Thank you.
Bullshit.
Thank you, and I agree with that.
They planned this with their simulation to inject agents to mislead the masses. So there's no critical thinking. Straight bullshit. Truth over fear.